Hey friends, my name is Nathan Lamaster, owner of Smart CEUs Hub, and I'm excited to be back for another episode of the Smart Start Recreational Therapy Insights YouTube series that we've been putting on for the last 30 weeks currently. I am excited to be doing these for you. Our goal, if you haven't been watching the other episodes, is to do a year's worth of content, so that's 52 weeks. One every Monday will be released, and they have been so far on schedule. And guys, thank you guys so much for watching these videos. It gives me a way to communicate and give back to the recreational therapy community, and just to see and hear from a lot of you about what is working and what isn't working, and some of the issues we're facing, as well as honing in and improving some of our recreational therapy skills in our tool belts. Guys, thank you guys so much for stopping by. Today is an episode for any of you that are in any type of leadership, management, supervisory roles, and we'll be talking about leadership and management specifically in recreational therapy today. It isn't just about job titles, guys, because you can have a really high up there job title and be a horrible leader, horrible manager even. And we'll talk about the little bits of the differences between leadership and management throughout this video as well. You can be both, but not everybody is. And it's mainly about influence, communication, and creating a culture within your workplace where people and programs thrive. Okay, so without further ado, let's dive on in. Okay, what makes a great leader in recreational therapy is the question for today. Okay, leadership in our field involves both professional competence, so how to do the job, and personal character, so personal character traits. Okay, great leaders inspire others with a vision. So they set forth a vision for the people that they are leading, so that they all know where they're headed. Okay, communicate clearly and respectfully to those on the team, because any great leader knows that a great leader cannot do it on their own. They need a team full of people that are skilled in various areas themselves, and you must show appreciation. You must show that these are the people on my team for a reason, and you got to stay calm under pressure. So in leadership, you not only have the pressures of being a therapist, you have the pressures of leading people. And there are a lot of complexities to that. So, for instance, your leadership style, their way of their strengths, right? Maybe you have your whole team take a Myers-Briggs personality test, which I highly recommend, because Myers-Briggs is a pretty well-respected personality quiz that lets you know a little bit about the people you're on your team with. They can also learn about you and how you operate. Which helps everybody to know, okay, so when I have this certain thing, this is the person, and this is how I need to say it to this person, because really you're working with different personalities. Okay, so you need to be able to build trust and empower others on your team. So a great leader isn't somebody who just, like a lot of business, I'm going to give you an example. So a lot of business owners, when it's their baby, and they're creating their business, they're growing their business, and they start thinking about hiring others, a lot of times there's a lot of fear there. There's a fear that they won't love it as much as you, they won't do as good enough a job, or whatever the thought is that you might have in the back of your head. But over time and through smaller tasks, you can help to build trust with those coworkers, those people on your team. And you might even find that they're really good at those things, and they might even be better than you. And I know that's a hard pill to swallow a lot of times, but the truth is people are skilled in different things. They might not be a great leader, but they might be a phenomenal therapist. Okay, they might be really great at building relationships with clients and inspiring them to grow and to be better, but they might not be management type leadership. Okay, does that make sense? And then a great leader must make ethical and client-centered decisions. Okay, so sometimes you'll be faced with an ethical decision, and you might be tempted to do the wrong thing, but your goal not only is to do the right thing, but also to teach those people on your team what the right thing is. Okay, so your vision and how you expect the team to function, if you aren't doing it yourself, you're being a hypocrite. And you need to be able to inspire your team members to have that same level of care and standard that you pride yourself so much on. Guys, whether you're a supervisor, a student, intern, you have a chance to lead through your actions and your attitude in the workplace. Okay, so now we're going to talk about leadership styles. So every leader has their own style. Let's break down a few common leadership styles in recreational therapy today. Okay, so authoritative is the first one right off the bat. This one is the one that rules and sets the direction for the team and says, this is what you're going to do, this is what you're going to do, this is what you're going to do. Sometimes that's a great thing. So in certain circumstances, especially in an emergency, you need people that are take charge, grab the bull by the horns, you do this, you do this, you do this. Okay. In short-term emergency situations, in crisis management, this type of leader excels. However, one of the potential downfalls of authoritative type leadership is when you want to build trust with your team. Okay, so a lot of times if you're too authoritative, you might appear as distant and you might appear as not respecting your team members, especially if those team members are wanting to show you how good they are at certain things and you're always the one just telling them what to do. Okay, so that can have a negative effect. Another one is the coaching type of leader. So a coach, just like on a team, they're going to focus on development of skills and giving feedback. Okay, so they will be great and excel at helping those on their team improve their skills and their ability to do the tasks that they're ahead of them. However, the negative that potentially can come with this is sometimes you hear this all the time, is the micromanager. So the person that is constantly overlooking over your shoulder and telling you what you did wrong, or telling you needed to do this, you need to do that. And eventually that can actually work then on your team as well, where your team starts feeling like they don't trust me, they don't feel like I can do my job, and it kind of builds an animosity. Okay, so be careful of that if you're in the coaching attitude, although coaches are great when it comes to building skills on a team. Okay, participative type leadership. Okay, it involves the team in decisions, great for morale and buy-in. So let's say you have a team of advisors, and let's say you're a CEO of a company, and this team of VPs, advisors, board members, whatever the case might be, are your sounding board for different things. And through hearing their feedback and everything else, you can kind of make the best decision based off of the multiple brains in the room. Okay, so this type of leadership style is particularly great in higher up decisions, in higher up positions, but also it can be great in just your small, little practice with one-on-one patients or within a group, allowing them to help make the decisions on how this activity or this intervention is going to go. Okay, so that's a great type of leadership. A potential downfall, I would think, with this is if there has to be a decision and you aren't comfortable just making it sometimes, and sometimes there isn't time to go back and forth, consult the whole team and consult your advisors, and you might, in the end of a crisis, for instance, you might not have time for that, and that type of leadership style might run short in that type of scenario. Okay, delegative type of leadership. Okay, trust others to carry out tasks independently. Okay, so this is the laissez-faire type mentality to leadership. So you may have heard that term. Laissez-faire means hands off. It's French. Okay, and what they do is they hire the people for the certain jobs, and then they just let them do it, and with like no vision, no direction, they just kind of expect that you know what you're doing. And that can be great for letting the team feel empowered. However, over time, they don't look at you like a leader. You just happen to be that person in that position. And there's not really a team aspect to that type of leadership. And I can arguably say that's not really a good type of leadership. Okay, transformational. So this is another type of leadership. Motivates and inspires through shared purpose. So this is the dream caster, the vision caster for the team. They say the big vision is we're going to be doing all this by 6 months from now, and we're going to be in here, and you're going to be great at doing this, and you're going to be great at doing that, and we're going to find clients like this, and they cast the vision, okay? And they leave the team members to try to figure out how to make that vision a reality. Okay, so this can be great if you are, high up there in a company and you are responsible for casting that vision. Okay, really great. However, in a day-to-day, how to make it a reality, how to do the tasks, a lot of times those vision casters lack those skills. And so it's good for people that are transformational type leaders to have somebody on their team that is very task oriented. Okay. And once you cast the vision, they are really good at making visions come alive. They might not have the creative sense to cast the vision, but they're really good at determining, okay, in order for that to work, then this has to work. And you need people like that on your team, and those people should definitely be elevated as well. Okay, a skilled leader adapts their style to the team and the situation. So not every leadership style is appropriate for every type of scenario. Some of them are better at certain types of initiatives than others. Okay, you might coach during a team meeting, but then take an authoritative approach during an emergency if there needs to be one. So you might be the person that can step up and do that, but you also might be the person that is looking to build up the team members. And honestly, the best type of leadership, in my opinion, is the one that serves those that are around them. Because as they get better, your team will achieve more together, and you'll be better for it. That is also knowing when to back off. So as a leader, you kind of get that feedback and that understanding from your team, like, okay, this individual doesn't like it when I come at them like this. They don't want a micromanager. They think that I'm being a micromanager. So maybe I need to adapt my leadership style to what works for them. And then this other person on the team might need you to tell them exactly what to do. Okay, and your responsibility as a great leader is to know when each leadership style is appropriate and be proficient in executing them. So not everybody can be a great leader, but if you have those skills, which are rare, right, that's amazing. Your team will go far. All right, management skills that every recreational therapist should know. Okay, management is different than leadership. Let's start off with just putting a clear definition of what management is and what leadership is. So management is when you are responsible for people or a team, right? And you are put in a position of management. Okay, so this is like, we're going to be achieving this goal together. Okay, now you might be a mid-level manager, you might be a higher up manager, you might be wherever, somewhere in between. But that is more to do with job title and what your responsibilities are. Now, leadership, on the other hand, can come at any of these levels, and a great leader could be in various positions, right? A great leader is using those leadership skills we just talked about in the last segment, and they're adapting them for the appropriate reason on the team. Now, you might have the role where you're also a manager and you are a leader, and if you put that into that, it's great. But you also could be a crappy leader and be a manager, right? And a lot of us have had managers in our workplaces that have not been the greatest managers. So that is one of the goals. They may have been promoted to that position because they were a really good therapist or they were really good at, being with clients, but the team dynamic is not their strong suit. And they just may have been promoted for that reason. So key skills that in management would be scheduling and time management. So they might be, okay, I need to have this person here at this time. I need to have this person scheduled to see this client or whatever the task might be. And they're the one that's coordinating that effort. Okay, so that's a manager. Okay, delegating tasks efficiently. So they're going to be telling who to do what on the team. Okay, that's a task of a manager, which obviously a good leader would be able to do that better than a poor leader. Budgeting and resource allocation. So sometimes the manager is responsible for maintaining a budget for the department that they're in. Okay, and that might have been decided by the higher ups, and it may or may not be a good budget in your opinion. Sometimes budgets are small for recreational therapy departments. Other places I've heard actually have really healthy budgets, and sometimes they feel like if I don't spend all this money, they're going to take it away. So they figure out what to do in those scenarios. But as a manager, you're going to be the one that's responsible for determining where that money is going and how it's being spent. Okay, so that's more of a skill rather than a leadership skill. That might have just been more like a task skill, a management type task skill. Setting expectations and following up. So a manager is going to set the expectations for whatever the tasks or program or service or whatever you're doing is, and they're going to follow up to see if it was done. Okay. And then performance evaluations, maybe quarterly, maybe monthly, however your company does it yearly. And they're going to be able to give the team members feedback of what it is that they're doing and where it can be improved upon, or whatever that case might be. And those evaluations a lot of times are really difficult for some managers because if they, like for instance, have a laissez-faire type attitude where they just put people in positions, they said, you're doing the job and I'm not really going to do much other than do my thing wherever I'm at in the building. And it's hard to really have an understanding of what your team members are doing in that scenario, and doing a review or an evaluation of them isn't really going to have much teeth. I mean, it might from a paperwork standpoint, and you're make your boss happy that you did these things. However, the people on your team aren't really going to grow from them because they don't even know that you have really any understanding of what they do. Okay, so I think a great leader would be somebody who takes time with each of the members of the team to really learn what it is they're doing and how they can be helped to be better at their jobs. So, and then at the end of the year, when you do the evaluations or whenever you do them, you'll have a lot more valuable feedback, and that person will trust you and respect you because you spent the time getting to know them. So, and what they do for the company. Don't forget, good management allows your staff and clients to flourish. Okay, now building strong recreational therapy teams. You don't just want a team that works, guys. Teamwork makes the dream work, right? You want a team that thrives. Okay, foster collaboration by hosting regular team huddles. Okay, at Smart CEUs Hub, our team meets monthly with our core team members, which is great because we get to discuss different aspects of the business and discuss what the needs are. A lot of times I get a to-do list from my people that work on my team, and they say, okay, I need this by this date. And it's my job as the leader in that scenario to figure out the best way to make those things possible, and sometimes say no, sometimes give some more ideas and direction. But at the end of the day, like having these team meetings makes everybody more feel connected, rather than like if we were constantly just doing our own thing and then never once spoke to each other. Okay. All right. Another way to foster connection is to create a safe space for feedback. Allow your team members to tell you what is or isn't working. And that could also be how you're leading them. Or it could be something that you've tasked them with that they're having a real difficult time with, and they're not seeing the results that you think they should be able to be seen. And you as a leader should really take that into consideration, because they're working with you and they're on the front lines doing the things, and they're going to have a lot of times some great understanding of what is or isn't working. So really allow them to give you that feedback. Then you can also foster connection by recognizing strengths and accomplishments. So I like to, in my personal, endeavors as a leader, to find skills or things or accomplishments that team members have done, and blast it out there in front of the rest of the company and rest of the team, so they all know that this person just did this. Okay, and they're doing a killer job. Make them feel really good and respected. Make them feel like they're appreciated. And in the long run, they're going to respect you more, and they're going to work harder. Okay, so doing those things really sets the tone. All right, you can foster the collaboration by celebrating wins, big and small. Could be things that they did that you're just like, hey, you did a really good job. Just like, recognizing their strengths, saying you're really good at this, but also their accomplishments. And then you can foster collaboration by encouraging shared responsibility for outcomes. So you might take a few team members and say, both of you are going to work on this task together, and you guys are going to figure out how to make it happen. And then it's kind of like a cool little challenge for them to figure out how they work within a team of just them to make something happen. And then they get to kind of tell you at the end how it worked. It's exciting. Sometimes you find that putting two team members together that have complementary skills can multiply the result. So make it so much more. And then great teams don't happen by accident. Okay, they are built on purpose. Now, the question you might be asking yourself is, I'm being put into a recreational therapy management role or supervisory role, or I'm starting a company and I'm hiring people. And in that case, you are the leader, you are the owner, the manager. And you might feel like you lack some of the skills to be a great leader. And if you're hoping to move into a leadership role at all, of any sort, here's how you can prepare. Seek mentorship from someone you admire. So someone that you feel is a great leader, someone that has shown you that they've been able to lead teams before or do something similar to what you're trying to do. And you can learn a lot from them. Get involved in committees or projects. Okay, so in those types of scenarios, right, you're getting put into a discussion with a team of people usually to seek, how we're going to work towards a certain goal together. And in that scenario, you might try out your leadership skills. You might be trying to see how you fit in within a team. Okay, you're going to develop your communication and public speaking skills. That's another great attribute to have as a team leader. Now, let me just tell you, so sometimes you'll hear me struggle with some words. That's not what I'm talking about. Those things happen to everybody. But showing confidence to your audience. So let's say you go speak at a conference in recreational therapy, or you are at work and you're talking to your supervisor or an interdisciplinary team. You are the person that owns your role, okay, whatever that role might be. Okay, so your confidence will be projected by how you speak, and how clearly you speak to others, how you make eye contact, talking with your hands, those types of things. And even the word can come in there every once in a while, and that is perfectly fine as well, as long as you are being direct with your content. Does that make sense? Okay. And then take continuing education and supervision or management. And like I'd like to pitch again on Smart CEUs Hub, we have a leadership and RT course. We also have management skills, those types of things. And you can learn a lot from other recreational therapists that are doing those tasks or those roles. And stay organized and solutions focused. Okay. People notice. Okay. If you have a goal and you're actually making things happen and you're not just a person who talks about things, but you actually do the things, people will see that, like, okay, you're serious. If I'm going to be on your team because I know we'll get stuff done together, and they'll get that dopamine hit of accomplishing goals, and so will you. All right, leadership is not about being perfect, okay? So no leader is perfect, just like people are not perfect in anything, really, okay? So it's about being present, intentional with those who are on your team, and willing to grow, okay? So leadership is from a point of humility and of confidence. All right, now let's wrap some things up for today, guys. Thank you so much for watching this video, if you've been watching it. I am interested in hearing from you about your supervisory, management, or leadership experiences. Please comment them below under this video. Help other recreational therapists that are thinking about management maybe, or are already currently managers, and help them to learn and grow from other people. You could be that mentor for them in a way. So whether you're leading a department, mentoring a peer, or guiding your clients, leadership and management skills matter in every recreational therapy setting. Invest in your own growth, and you'll inspire others to do the same. Okay. All right, coming up next week, we'll be talking about motivational interviewing basics. So you may have heard the term motivational interviewing, and we will be going over the basics in this video. Probably in a future video, we'll get more into the trenches of how to do all of it. But we'll be starting with the basics because some people might not know what motivational interviewing is or what it would be used for in their practice. So it's kind of like that teaser to figure it out. You're going to learn how to guide clients through change by helping them tap into their own reasons to grow. Okay, and you won't want to miss it. Guys, I hope you have a happy Monday, and as always, signing off. Stay classy, rec therapists.